Good afternoon, my name is Juliana and my partners are Myriam and Brooklyn, and this week we worked on studying chronic leukemia. So chronic leukemia is a malignant disease that affects the blood-forming organs, and so a lot of times people associate the cause of leukemia being an overproduction of leukocytes, and so these can be found in the lymph nodes or your spleen and liver and the central nervous system. So symptoms are sometimes pretty vague, which is really difficult to detect leukemia, but a lot of people will, you can see it, or some symptoms could be like being very drowsy or weight loss or weakened stamina during exercise, and so a lot of times people will go into the doctor for that and then they'll use that as kind of a basis. So what doctors or PAs will do when they're assessing someone is they will palpate the lymph nodes a lot, and they'll also try and palpate the thorax and try and contemplate what, like if it's thicker or things like that. And then something that is really important is they will do a complete white blood cell count or complete blood cell count. And so I have a little test question for you guys that relates to our other class for nursing. What else would you do a white blood cell count for with a patient?
Fever.
Yeah, pyrexia. Good job. I just wanted to test you. Yeah, so that I like just assessing them is palpating the lymph nodes, and then really important doing a blood cell count. So the causes also for leukemia are pretty vague. The highest one is leukemia is just an extremely hereditary disease. So if it's running in your family, then you're at great risk for it. Something I also saw was that herbicides and pesticides are a cause to it. I don't know how great that cause is, but I think that is pretty interesting that it is linked to leukemia. And then, so it also just talks about that, like in the bone marrow, that's where the increased leukocytes will be, and the increased white blood cells. Diagnosis, like I said before, a complete blood cell count. That one's not as invasive, and if that, you could go one step further and do a blood bone marrow biopsy. So it talks, like it talked about in the book, that if the bone marrow is normal, there will be not as many or no leukemia cells present, but then it talked about that if you do have leukemia, it's in abundance. Like the leukemia cells are in abundance. It's not like a small trace. It's in abundance. Okay, so treatments. There is one. It's called prednisone. Prednisone. Yeah. And so that one's a little less invasive. It's just like a small daily dose that will decrease your autoimmune response. And then obviously with leukemia, a treatment is chemotherapy, which is just a really painful, frustrating process that will be really just emotionally and wearing on the body in all aspects. So unfortunately with leukemia, chemotherapy is the biggest form of treatment. So like I just stated, with prognosis and follow-up, being diagnosed with leukemia is crazy emotional, and I was reading a couple articles too that talked about that. It runs in the family, and so you're sometimes used to it, but then it's still just like a shot of darts towards you, like this is a deadly disease and it's affecting life. And so being mindful of that, I think as nurses and also as Christian nurses, I think is super important. Life is really precious. And so obviously being emotionally mindful of patients, I think is a key aspect of being a nurse. And so going forward, if a patient chooses to go through chemotherapy, something that I read a lot about was comfort care, and your body is in just extreme discomfort during chemotherapy. You feel like you have this massive flu for weeks on end. Your body's so weak. And so comfort care and just being mindful that a patient is just in constant discomfort really helps you be a better nurse, because empathy is sometimes the best medicine you can give towards people. So then also as nurses, you guys probably know that education is a huge part of our job, and so people will have their chemotherapy treatments and then they'll be going home for certain things, and so it's important to remember that when people are going through chemotherapy, they're at risk of fall, risk of bleeding. They need to be mindful actually of like the raw foods, kind of going back to like pesticides and herbicides. Yeah. So yeah, just being educational towards them of what their life needs to look like at home. Those are my sources.